With this extraordinary shoulder operation that's happening, Mr. Povlsen has just done a tiny, tiny incision into the back of Florence's shoulder, and we're getting these extraordinary views of inside the joint. But first of all, Imed, how's Florence doing? Is everything all right?
She's doing fine, yes.
Yeah?
She's very stable. She's
very
doing
stable,
fine. Yeah.
calm, good. And what stage are we at now?
So now we're just about to remove the scar tissue that we can see quite clearly in the joint now. I put in this little ultrasound wand, and you can see there's little grills on it there at the front.
This is an ultrasound wand?
Yeah. And that will, by touching the tissue, it will remove the scar tissue that you can see up there, the red inflamed tissue.
This area here is all scar tissue.
Yeah.
And is that scar tissue formed when she broke that tendon and damaged those muscles?
That's correct.
And how does I thought ultrasound was used for scans?
Yeah, but if you just use enough of it, it creates energy that warms up the tissue, and we would like to see that the water around it will start to bubble because it gets boiling.
Right.
Okay, so here we go.
All right. Gosh, look at that. So this is actually removing that tissue,
It just moves, turns it into water and air. Just by touching it, it actually vaporizes the tissue. It simply disappears. It just melts away.
So once this scar tissue is removed, should Florence's shoulder be absolutely back to normal?
No, she will have a great deal of more pain because I'm basically burning her shoulder from within. So obviously she will have a lot more pain, but hopefully this scar here will be able to heal and not leave her with a lot of tissue that can cause pain. So that's the idea.
Does the scar tissue effectively sort of restrict the movement? Is that what's causing her the pain now?
It's not restricting the movement, but it's causing a lot of pain, and therefore she doesn't want to move the shoulder herself. Because when she's moving the muscles, it's pulling in the scar tissue, and that's causing the pain.
But by doing this, aren't you just going to create more scar tissue when it heals?
No, because this will heal in a much more controlled way. And also it stops the bleeding. There won't be any bleeding because it coagulates the vessels. And a lot of this scar tissue that was formed was because it bled a lot. So we're just removing and stopping any bleeding from happening.
Gosh, look at it. I mean, it looks completely different already from that very kind of pink, sort of livid looking tissue. It's now looking much more kind of benign.
So we're just removing.
And is this a fairly new technique for mending muscle tissue?
Certainly. It's important that it doesn't mend anything. It just removes the tissue that causes pain. And when one is 80, then the muscle doesn't really heal.
Right.
Probably half of all patients who are over 70 have similar injuries, but they don't have pain from it. So we only need to treat the pain that's restricting her from using the shoulder. It's not that you can't lift the shoulder. You can see that when I help her, she can actually lift it.
Yeah, she had reasonable mobility with it, didn't she?
But it's the pain that's associated with it that's the problem.
And can you use this technique on other muscle injuries?
Yeah, or any scar tissue anywhere in the body, in theory. We use it for knees, and I use it for wrists and elbows as well. So it's a very versatile procedure.
It's absolutely amazing. And how much longer will you need to do this until you've cleared all her scar tissue?
Another 5-10 minutes. That's probably all it takes.
Well, that was fascinating. Thank you very much indeed. And hopefully we'll keep our fingers crossed that Florence will eventually have no more pain in that shoulder. Thank you very much.
You're welcome.